A hidden threat, understanding toxoplasmosis. Toxoplasmosis is a parasitic infection. It is caused by a tiny parasite called. This parasite is found all over the world. It infects a wide range of warm-blooded animals. This includes humans, cats, pigs, and sheep. Most people who get toxoplasmosis don't even know it. They have no symptoms. However, the parasite can cause serious problems for certain people. Pregnant women and people with weakened immune systems are most at risk. Toxoplasmosis is a silent threat. It often hides without causing any obvious signs. This makes it even more important to understand the infection. We need to know how it spreads and how to protect ourselves. Understanding toxoplasmosis begins with knowing its cause, the parasite. This microscopic organism is remarkably resilient. It can survive in various environments, making it a persistent public health concern. Pathways of infection. How toxoplasmosis spreads. Toxoplasmosis spreads in several ways. One of the most common ways is through contact with cat feces. Cats are the definitive hosts of the parasite. This means they are essential for the parasite to complete its life cycle. Infected cats shed the parasite in their feces. Humans can become infected by accidentally ingesting the parasite. This can happen while cleaning a litter box or gardening in contaminated soil. Another common way to get toxoplasmosis is by eating undercooked meat. The parasite can live in the muscles of infected animals. If the meat is not cooked to a high enough temperature, the parasite can survive and infect humans. Toxoplasmosis can also be transmitted from mother to child during pregnancy. This is called congenital toxoplasmosis. It can have serious consequences for the baby. These include vision problems, intellectual disabilities, and even death. Finally, toxoplasmosis can be spread through blood transfusions and organ transplants. However, this is much less common than the other routes of transmission. Silent intruder, recognizing the symptoms. Most people with toxoplasmosis have no symptoms at all. They are considered asymptomatic. The infection is usually mild and clears up on its own. However, some people do experience symptoms. These symptoms can vary depending on the person's overall health and the severity of the infection. Common symptoms of toxoplasmosis include fever, headache, muscle aches, and swollen lymph nodes. These symptoms are often mistaken for the flu or other common illnesses. This can make it difficult to diagnose toxoplasmosis based on symptoms alone. In more severe cases, toxoplasmosis can cause eye problems, brain inflammation, and even death. People with weakened immune systems are particularly vulnerable to these complications. This is because their bodies have a harder time fighting off the infection. Vulnerable populations. Who is most at risk? While toxoplasmosis generally causes mild or no symptoms in healthy individuals, certain groups are particularly vulnerable to its severe manifestations. Understanding who is most at risk is crucial for targeted prevention and early intervention. Pregnant women are a high-risk group. Infection during pregnancy can lead to congenital toxoplasmosis, potentially causing severe complications for the developing fetus, including miscarriage, stillbirth, or birth defects. Individuals with compromised immune systems, such as those with HIV/AIDS, organ transplant recipients, or undergoing chemotherapy, are also at increased risk. Their weakened immune responses make them more susceptible to severe toxoplasmosis, including encephalitis, pneumonia, and other life-threatening conditions. Infants born with congenital toxoplasmosis may not exhibit symptoms at birth, but later develop serious health issues like vision or hearing loss, intellectual disabilities, or seizures. Early detection and treatment are paramount to mitigating these long-term consequences. Section 5. Safeguarding your health. Effective prevention strategies. Preventing toxoplasmosis involves a combination of responsible practices that minimize exposure to the parasite. By incorporating these simple yet effective measures into our daily routines, we can significantly reduce the risk of infection for ourselves and our loved ones. Food safety is paramount. Thoroughly cook all meats, especially pork, lamb, and venison, to their recommended internal temperatures. Freezing meat for a period before cooking can also help kill parasites. Wash hands, utensils, and surfaces that come into contact with raw meat meticulously. Cat owners play a crucial role in prevention. Change litter boxes daily, preferably wearing gloves and a mask, as this is when oocysts, the infectious form of the parasite, are most likely to be present. Pregnant women should avoid cleaning litter boxes altogether. Feed cats only commercial cat food, as raw or undercooked meat can contain the parasite. Maintaining good hygiene is essential. Always wash hands thoroughly with soap and water after handling raw meat, gardening, or touching cats. Avoid drinking unpasteurized milk and wash fruits and vegetables thoroughly before consumption. Section 6. Seeking treatment. Managing toxoplasmosis. In most cases, healthy individuals infected with toxoplasmosis require no specific treatment. Their immune systems effectively control the infection, and symptoms, if any, are mild and self-limiting. However, treatment becomes crucial for specific populations and severe cases. Pregnant women diagnosed with toxoplasmosis during pregnancy require immediate medical attention. Antibiotics like spiromycin or a combination of pyrimethamine and sulfadiazine with folinic acid can help prevent transmission to the fetus and manage the infection. Immunocompromised individuals with toxoplasmosis usually need treatment. The specific medications and duration depend on the severity of the infection and the individual's overall health. Prompt treatment is essential to prevent potentially life-threatening complications. Infants diagnosed with congenital toxoplasmosis require treatment to manage the infection and prevent long-term health problems. Treatment usually involves a combination of medications and close monitoring by a pediatrician experienced in managing toxoplasmosis. Section 7. Protecting our future. Toxoplasmosis and pregnancy. Toxoplasmosis poses a significant risk during pregnancy due to its potential to cause congenital toxoplasmosis. This occurs when the parasite crosses the placenta, infecting the developing fetus. The consequences can be severe, ranging from mild to life-threatening. Pregnant women should take extra precautions to avoid toxoplasmosis. These include avoiding contact with cat feces, thoroughly cooking meat, and practicing meticulous hand hygiene. Regular prenatal checkups are crucial for early detection and management. If a pregnant woman is diagnosed with toxoplasmosis, treatment options are available to minimize the risk to the fetus. The choice of treatment depends on the stage of pregnancy and the severity of the infection. Early diagnosis and treatment are essential for the best possible outcome. Preventing congenital toxoplasmosis requires a multi-pronged approach involving education, prenatal screening, and prompt treatment when necessary. By prioritizing these measures, we can protect the health of both mothers and their babies. Section 8. The importance of awareness. Public health implications. Toxoplasmosis is often referred to as a silent epidemic due to its high prevalence and frequently asymptomatic nature. Understanding its public health implications is essential for effective prevention and control measures. Public health campaigns play a crucial role in raising awareness about toxoplasmosis. These campaigns can educate the public about transmission routes, risk factors, and preventive measures. Targeting high-risk groups, such as pregnant women and immunocompromised individuals, is particularly important. Early diagnosis of toxoplasmosis is crucial, especially in pregnant women and immunocompromised individuals. Prenatal screening can identify infected women early in pregnancy, allowing for timely intervention. Improved diagnostic tools and surveillance systems can help track the prevalence and spread of the parasite. Addressing the public health challenge of toxoplasmosis requires a collaborative effort involving healthcare providers, public health officials, and the general public. By working together, we can reduce the burden of this often overlooked infection. Section 9. Conclusion. Staying one step ahead of toxoplasmosis. Toxoplasmosis is a widespread parasitic infection with the potential to cause serious health problems, especially for pregnant women and individuals with weakened immune systems. However, by understanding the parasite's life cycle, transmission routes, and risk factors, we can effectively minimize our risk. Simple preventive measures, such as practicing safe food handling, maintaining good hygiene, and taking precautions around cats, can significantly reduce the likelihood of infection. For those at higher risk, prenatal screening and early treatment are paramount. Public health initiatives that raise awareness, promote early diagnosis, and support research efforts are crucial to controlling the spread of toxoplasmosis. By staying informed and taking proactive steps, we can stay one step ahead of this silent threat and protect the health of our communities.